U.S. healthcare spending is growing at a surprisingly slow rate, and we've got David Wessel, Chief Economics Editor here at the Wall Street Journal, to tell us why it matters. He joins us now from Washington, D.C. David, I hope you had a good break.
I did.
Great, good. So this is good news to come back to. I'm thinking healthcare spending is growing at a lower rate.
That's right. So what we've seen over the last couple of years is an unusual slowdown in the rate of increase in healthcare spending per person. And we know that a lot of it has to do with the recession. People put off elective surgery. They went to the doctor much less. Some of them cut back on prescription drugs, or they switched from brand name drugs to cheaper generic drugs. The big question now is how much of this was the result of the recession and how much reflects something more lasting. Perhaps a change in consumer and health provider behavior that'll save us some money over the next decade.
Okay, so let's go back to other things that might have caused that. One of the things you know in your column is that higher deductibles are being used, right? You know, over $1,000, and that's a bit of a hump to get over.
Right. So we know a couple of things have happened. What we don't know is exactly what effect they're having. Many more companies are either enticing their employees or forcing them to take these high deductible plans, which means that you feel more pain when you go to the doctor or, have to decide whether you get an MRI or a CAT scan if your doctor says, well, it's kind of optional. So that may be leading people to change behaviors in ways that will go beyond the recession. The other thing that may be going on is that providers themselves may see the writing on the wall. Now that the Obama healthcare plan has been declared constitutional and there's a lot of pressure to change the way medicine is practiced, it may finally be changing the way they do business.
Now that's interesting, because one of the things I would think is if you have less health insurance, you would want to take more care of yourself. You want to eat better, you want to exercise more, because you know that you're going to be out of pocket if you didn't. I mean, you see where I'm coming from, David, right?
Right. I think that would be nice if that were true, but I don't think that's the case. I think it's people have every incentive to eat healthy and be healthy and exercise because they will live longer. I don't think they're doing it for economic reasons. So there are some companies now that are giving people a bonus if they agree to join the gym or if they quit smoking and stuff. I think that where the high deductibles make a difference is it makes people hesitate before they go to the doctor or take their kid to the emergency room stuff. Of course, the risk is that some people will not go who should, and that's why it's not so clear always whether it's a good thing or not.
David, we're looking at a chart now from today's paper,
right.
But basically shows growth rate. So although the line is going down, it still means that costs are increasing. One of the people in your column that you quote says he thinks it's temporary. What's the reasoning behind that?
Right. Well, here's the thing. There's no set of facts that will answer the question, is this permanent or temporary? It really has a lot to do with one's diagnosis of what's going on. So in the column, I quote Jerry Anderson, who's an economist at Johns Hopkins, and he says, look, in the 90s, healthcare cost growth slowed, and we know why that was, because managed care became much more pervasive for a brief period of time. He doesn't see anything in the developments now that would account for that, so he thinks a lot more of it is temporary. But other people, I quote David Cutler of Harvard University, Peter Orszag, who was President Obama's former budget director, they think that something more significant is going on in the way medicine is practiced. And they predict that when the recession and the recovery are bad memories, that we'll see that the pace of cost increase has slowed for a long time.
So someone I was talking with pointed out that LASIK surgery, which typically isn't covered by healthcare, the price of that has plummeted, healthcare insurance, that's plummeted, and that's where insurance isn't involved. Is there any way that if we didn't have insurance, if we sort of abolished the insurance idea and everything was out of pocket, that we'd see prices plummet?
Well, people do use that LASIK example. Paul Ryan, the chairman of the House Budget Committee, uses it himself. He had LASIK surgery, and he points out because there's a lot of competition among the providers and because people aren't insured, the price is forced down. There are attempts to introduce more competition into the healthcare market just for that reason. The exchanges that President Obama is pushing as part of his healthcare plan, the Affordable Care Act, are a way to organize competition among insurers. But there's an awful lot of evidence that people don't shop for healthcare the way they shop for other things. I mean, I did a story years ago about heart bypass surgery in Pennsylvania, where people had information about which places were expensive and had worse track records. And it turned out that people would go to the high cost, low safety place to get a heart bypass surgery because that's where their family doctor recommended, and they don't really shop around. So I think the competition is part of the answer, but when it comes to healthcare, it's not the whole answer.
Not the whole answer. Great column, David. Thank you very much for joining us.